don't. There's no history of medicine or nursing in my family at all. I was born and brought up in the northwest. My father is a hydraulic engineer and my mother was an accountant. So I suppose the closest thing to hearts would be the hydraulic pumps that my father worked on and designed. But other than that, absolutely none. I've thought about that often and quite a lot. And I knew from my earliest days in medical school, when you're first being taught how to take a history and examine a patient, that I wanted to do cardiology. And I'm sure it's because of the first time that I'd ever actually used my hearing to diagnose things, to think about disease. And I'm sure it was the sounds of the heart that first inspired me. And then it became apparent that cardiology as a specialty was virtually unique in that it sits between the diagnostic skills of medicine and the interventional and practical skills of surgery. So you get the best of both worlds. You can be a diagnostician and an interventionist, somebody who does something. I undertook my undergraduate medical training, i.e. a medical student at Manchester University. I would say there were approximately 30 to 40% of my year were female. Having done my undergraduate training and got the medical qualifications, I then did my junior doctor training for general medicine in the Manchester teaching hospitals. You're required, quite rightly, to pursue general medical training. If you want a career in hospital medicine, you have to undergo a prescribed and rigorous set of training requirements, and that essentially means working for different specialties in the hospitals to gain experience of all of them. At the end of that period, which is usually 2 to 3 years, you then have to sit an examination set by the Royal College of Physicians, which is in 2 parts, a written part, a theoretical part, and a practical part, and you have to pass both of those to become a member of the Royal College of Physicians. Once you've done that, then and only then can you enter on a specialist training course. I did indeed. The first mentor, I would say, was Dr. Arthur Holman at University College Hospital. Having decided to become a cardiologist, I moved from Manchester to London to undertake my cardiology training, and he was the first cardiologist I worked for as a registrar, and he was a superb diagnostician. He was absolutely brilliant. I then moved to Guy's as a registrar and worked for Dr. Paul Curry and Dr. Edgar Soughton, and I think Edgar was probably the best UK cardiologist of his generation. He was truly inspirational, and it was there that I developed my subspecialty interest in electrical abnormalities of the heart, the so-called arrhythmias. I have to mention another mentor. I worked subsequently at the National Heart Hospital, where I worked under Jane Somerville, who was a paediatric cardiologist and quite a remarkable woman, truly attractive, a very feisty lady, and I admired her enormously. My first procedure was at Guy's Hospital, and we were trained initially on the simpler procedures such as coronary angiography, which is where a small tube is inserted via an artery either from the arm or the leg to the coronary arteries to see if there's any furring or narrowing. So the first procedure we're trained with was that, and having been trained and supervised until you're believed to be truly competent, I would then have 2 sessions a week, a session being 4 hours, plus of course those were elective, those were planned sessions. In addition, there would be the emergency out of hours work as well. Perhaps I was lucky, but no, I never encountered any obvious discrimination. Indeed, many patients commented that they were actually pleased to have a lady doctor because they felt that I perhaps had a gentler touch than the men. In terms of discrimination by colleagues, no. I was, again, perhaps lucky, but I truly worked with what I would regard as brilliant minds at the National Heart and at Guy's, and it was so exciting. There was no thought of discrimination. It was just a very exciting time and specialty to train in, and I loved every minute of it. It's called a wellness village, and again it is really a project between three partners: Swansea University, Carmarthenshire County Council, and the Stirling team led by my husband, friends and I. The idea behind that is to bring care closer to the patient, but this time to bring it out of the District General Hospital and into the community, and also to keep people who perhaps are frail, elderly, in their own homes longer and safer. In order to achieve much of this, we are going to have to use digital technology, and we have been working with industry partners to achieve this, so that when the village opens, which we believe will be in 2 to 2.5 years' time, this will all be in place. I've been heavily involved in all the clinical aspects of the project, including the digital health technologies. I've been advising on how patients and indeed their relatives, the local population, can perhaps be best served by the village from a clinical point of view. In all honesty, there have been at least several of them, and it has to be when my team and I see a patient walk out of hospital who you never expected would do so. And I still remember them, I still see their faces, and I'm in touch still with many of them. They write to me or call, email, and it's wonderful. I don't watch them very often, to be honest with you. I think it's because I would find it a bit of a busman's holiday, so I don't watch them much. But I believe the episodes I've caught, they seem to be very well researched and very good. The days of the sort of Dr. Kildare with the chest x-ray the wrong way around seem to be over, thank goodness. So yes, they do seem to be good programmes, but I don't watch them because, as I say, I think it's a bit of a busman's holiday. I enjoy walking, particularly this season because we've had such a wonderful autumn. I like reading, but I particularly like detective fiction. Maybe that's the diagnostician in me, but I really enjoy reading detective books. Music, I play the piano badly and would like to play more, but perhaps maybe my husband wouldn't because it's a bit discordant. And I used to love skiing, but I don't bounce as well as I used to, so that is probably best left for the time being.